Let's dive into this week's top stories. A former National Security Agency employee is sentenced to nearly 22 years in prison for trying to sell U.S. secrets to an undercover FBI agent. Prosecutors say Jared Dahlke attempted to sell top-secret national defense information, demanding $85,000 in return. He was arrested after trying to transfer the files to an undercover agent in Denver back in 2022. In 2023, Dahlke pleaded guilty to the crime, admitting he intended to benefit Russia and hurt the United States by sharing the information. The National Security Agency, the FBI, and the State Department issue a joint cybersecurity advisory about a North Korea-linked cyber threat group known as Kimsuky. Kimsuky, also known as Emerald Sleet or APT-43, aims to gather information on issues that could impact North Korea. The joint cybersecurity advisory says the group is sending emails posing as legitimate journalists, academics, and other experts to gather information related to geopolitics and foreign policy strategies. They're collecting data to strengthen North Korea's regime. The CSA is advising organizations to ensure they're implementing demarked security policies. They also recommend organizations follow CISA's cross-sector cybersecurity performance goals. The FTC finalizes changes to the health breach notification rule to include health apps and other technology not previously covered by HIPAA. Now, vendors of personal health records are required to notify people, the FTC, and in some cases the media when personally identifiable health data is disclosed or acquired in a security breach. Depending on the size of the breach, people and the FTC must be notified at the same time and within 60 days of discovery. It also expands ways people can be notified to include electronic communication like email. More than 533,000 people are affected in a Wisconsin Health Cooperative data breach. Hackers apparently accessed the network of Group Health Cooperative of South Central Wisconsin in January. They tried and failed to encrypt the systems. They were able to copy sensitive data including names, email addresses, birth dates, social security numbers, and more. A foreign ransomware gang claimed responsibility for the attack. The co-op has stepped up security measures and is asking those affected to report any suspicious activity on their statements. A cybersecurity breach at MedStar Health affects more than 184,000 people. According to the Department of Health and Human Services, someone hacked into employee emails and files between January and October of 2023. The files included names, addresses, birth dates, provider names, and health insurance details. It's unclear whether the hacker viewed or took any of the sensitive information, but MedStar has beefed up its security measures to prevent similar breaches in the future. Nearly 500,000 patients are impacted in a January data breach at Receivable Solutions. The revenue cycle service company says someone hacked into its system that contained names, addresses, social security numbers, driver's license numbers, and ID card numbers. It doesn't have any evidence that information was misused, but it notified affected individuals and about 17 organizations it works with. It's also reviewing existing policies to improve its security. Third-party breaches like this are having a massive impact on healthcare organizations. A recent security scorecard report shows 98% of organizations are affiliated with a third party that's experienced a breach.